Good afternoon, and thank you for joining us for this Facebook Live chat. Now, millions of concussions happen in the United States every year from sports, falls, car accidents, accidental head impacts, and they can happen to anyone at any age. Now, today is National Concussion Awareness Day, September 21st. It's a chance to raise awareness and to talk about signs and symptoms, treatment options, and the physical, social, and emotional issues that can result from a concussion. And joining us is Dr. George Morris, and he's the sports medicine physician here with CentraCare. He's going to answer some of our questions. Now, if you do have a question, feel free to leave it in the comments, and we will ask Dr. Morris. So, first question is, what is a concussion?
Well, Karna, thanks very much for hosting this event. I'm very appreciative of the opportunity to talk about concussions and what happens in our community with those. Concussion is a mild head injury. It's a brain injury that happens either when you hit your head or your head hits something, or it can also happen in times when your body gets hit and then your head shakes rapidly. We'd see that in whiplash type injuries, a big hit in football or hockey, and another area where we also see it are blast injuries, or in our military members, where they get blown off their feet, unfortunately, and their head can get injured along with the rest of their body.
So what is the most common cause of a concussion?
A hit to the head. More of the common causes that we see are bicycle accidents, car accidents, and then along with that are the sports-related injuries.
Okay, so when a concussion happens, it's your brain inside your head moving about as it should probably not.
Correct. Our skull is a bony vault or a ball, and then within that is our brain, and our brain is kind of soft. And so when your head moves suddenly, the skull will stop, but your brain keeps moving. And then it'll either get shaken or it'll bump against the walls, and that is what causes the injury.
Right. Do helmets and mouth guards help protect against concussions?
Helmets and mouth guards are designed primarily to protect the skull and the bone and the brain against a serious injury, and mouth guards for protecting the teeth. Now they are trying to do some new research on advanced helmets that will help slow down the motion of the brain within the skull. But we still come down to there isn't a concussion-proof helmet. We still advocate for helmets in all of the risky activities or sports because they will keep our skull and our brain as safe as possible.
How can I tell if someone has sustained a concussion?
Some of the simple things you might call them as the signs are after a head injury, a person might seem a little confused, a little dazed, they might feel foggy. Sometimes it's a feeling of, well, I just don't feel right. And that's a hard thing to describe, and for each person it's a little different. Occasionally we'll also see people that have difficulty remembering everything that happened around the event, whether that is as I said, a fall, a car accident, a fall at home or on the playground or during a sports game. You may also see people where their vision is a little double, a little blurry. Eventually, some of the longer things are the person will also complain of a headache. They might complain of being dizzy, a little queasy to the stomach. They may also experience some difficulty processing or thinking and not be too clear.
Is a concussion always obvious right away?
It's not always obvious right away, and in fact we also see people that have the head injury or the injury to their body and they feel okay, so they think, yep, I'm fine, I'll be okay, and then a day or two later is when they really start to notice the light is bothering me, the noise is bothering me, I'm having trouble in school or at work, and I have a headache. And those are times that we say you can have a delayed onset of the concerns of a head injury.
You talked about this a little already, but some of the most common symptoms of a concussion, so once you've received a concussion, what other things can it affect?
Yeah, the big ones are how you feel, along with the headaches, which just make you, something that bothers you a long time. The other things that can affect are the school performance or your work performance. I know a lot of times we focus on kids and, football, hockey, other sports-related injuries, bicycle accidents happen. And what we worry about is that those things will affect their ability to pay attention in class, take tests, read, especially when you're calling it reading for comprehension, reading to understand, doing things to actually learn. And for many of us at work, we're also supposed to be able to think at work and process and remember things and get tasks accomplished. And those are things that can be affected by head injuries.
How is a concussion diagnosed?
We call it a clinical diagnosis, which means that there is not a one test, either a blood test or a image test, such as a CT or MRI, that tells you this was a concussion. What we more go based on are having a trained professional evaluate the individual, look at their signs and symptoms, as we kind of discussed, do a good physical exam, including looking at their function of their brain, their eyes, their nerves, their balance, their speech. And we also can do some additional tests on their memory, thinking, comprehension, what are oftentimes called computer-based testing, along with some other vision and coordination-based testing. But in the end, it still comes down to having an experienced clinician take a look at them and bring all that pieces of information together and say, this was a concussion.
Because there's not, as you said, there's not a blood test where you can say, well, oh yes, this person, but it's more of just relying on the experience and having known what those symptoms are.
Yeah, it's much more of the story. We do see research looking into blood tests that will also help us, or different imaging tests, again, meaning CAT scans or MRIs. But a lot of times we'll use those tests to make sure more serious injuries haven't already happened.
How long does it take to recover from a concussion?
We'd like to say anything from 1 week to lifelong effects. What we want is to see more people that only experience problems for a week, maybe 2 weeks, as opposed to the lifelong effects. The things that we can do to help, shorten that are really to identify it early and help develop a treatment program for the person as soon as possible.
How many concussions are too many?
Unfortunately, for each person, there isn't a set number. So for a person, 1 might be too many. We do see people that are a little bit more susceptible to long-term effects of head injuries, and we try to be a little bit more careful for that. There are additional research showing challenges that what we call subconcussive effects, just minor repetitive heading, or a football lineman that may not have had a big hit, but just keeps getting their little head injuries over time, also adds up. So we'd like to say there's not a set number for a concussion that is too many, and also we have to take into account those small little injuries that add up over time.
If I have a child that sustained a concussion, do they need to see a doctor, or can they just go to bed and ride it out?
A lot of times we say, when in doubt, sit them out, is one of the easy phrases to remember. And if you're at a game or a playground with your child and they've hit their head, or you think they've hit their head or had a concussion, I do think it's okay to say, well, let me just watch them at home. Not every head injury needs a visit to the emergency room, though each of them should be treated serious enough that we do watch closely and get them checked out before we put them back in a game or a risky situation. So my advice would be, if you think they've sustained a concussion or a head injury, it is best to talk to one of your healthcare team members.
Okay. Is there something that parents can do, or is there a certain sign or symptom they should look for if they are really concerned and think that it might have been a significant concussion?
Yep, I would say there are a few things that we would call are the serious or the real red flags. One of them would be if a child or even a parent or an adult is throwing up frequently. So if you can't keep food down, or you're just throwing up even without eating, that is something that we should see right away. The other ones can be if the pupils are different sizes. We should be seeing you sooner rather than later, more an emergency. And other ones are if you can't be woken up. So in other words, you get drowsy, sleep, and you're hard to disturb or wake up. Those would be probably some of the big ones I would look at. Anything that there's a risk of a neck injury, we should be seeing right away. Or if a person has difficulty with speech, feels tingling, numbness, or a little weak on one part of their body. So that's a long list, so I'll try and kind of summarize that again. Throwing up too much, difficulty waking up, symptoms that seem to be getting worse over a short time period, increasing, tingling, numbness, or one part of the body that may have difficulty moving or sensing things, and then speech changes. Those are don't stop, come in right away, or call 911.
The last question is, what are some good resources that parents or anybody can look at to kind of learn a little bit more about concussions?
I would say a few. One, we have some online resources that are available to all of us. Locally, we have Project Brain Safe, which is doing a good job of working with a lot of our community health practitioners, schools, businesses, and organizations. And we have over 40 different community members involved in this project that really helps support at least 7 different local school districts in this area. We work with 9 different health clinics, or healthcare entities such as, I'd be remiss if I try and name them all, but I'm going to try. CentraCare, Williams Integrated Care, Simplicity Health, St. Cloud Medical Group, St. Cloud Orthopedics, NovaCare, Rehab, local eye clinics that we work with, and I think that's probably, and I apologize if I missed out 1 or 2, but most of the local healthcare team members are part of BrainSafe. The other ones that are a real good online resource are cdc.gov. And that has been an excellent resource for a lot of us. They really target the information both on healthcare practitioners and to parents and to athletes. So you can get, you might say, 3 different levels of information available to you, and they have a lot of tools to help us out.
Great. Well, thank you so much, Dr. Morris, for all this information about concussions. Again, today is National Concussion Awareness Day. That is September 21st. And again, the resources that Dr. Morris mentioned, Project BrainSafe, and that website is brainsafemn.com. And then the CDC, you can go to cdc.gov and then look for Heads Up, and that is where you can have learn a little bit more about concussion and concussion awareness. So again, thank you so much for joining us, and everyone out there, have a great day.
Thank you.